Hello, my name is Dr. Ken Goolsby. I'm a psychiatrist in Gainesville, Georgia, and today we're talking about depression. Depression is an illness that we are really beginning to better understand. This is such an exciting time to live with the new advances that we're having in understanding so many things in medicine, including the brain. We know the brain is an electrical organ primarily. The heart is an electrical organ. Its electrical activity is measured with an EKG. The brain's electrical activity is measured with an EEG. Our current understanding of the brain is that we have specific networks that have very complex relationships with each other. And when these networks are fully integrated and resonating with each other and balanced, we do very well. When these networks are out of synchronization or are not balanced, we do not do well. Specific examples of this are symptoms of depression, such as low energy, difficulty concentrating, difficulty experiencing pleasure, feeling a very deep feeling of hopelessness, and even suicidal thoughts. We now know that those symptoms occur because of specific areas that have increased connectivity or functional connectivity and areas that have decreased functional connectivity. Depression is a devastating illness, and the suffering from depression often cannot even be put into words. It is so deep and so painful. Thankfully, we now have new treatments available which are able to very effectively treat depression for those who have not responded to antidepressant medications or therapy. One example of a new treatment available is TMS, which stands for transcranial magnetic stimulation. And it's really a simple idea. We're using a magnetic source of energy which creates an electrical field in nearby conductive tissue on the cerebral cortex, and we're able to stimulate specific brain networks that are out of synchronization or out of balance in depression. We do that by placing the coil on the left dorsolateral prefrontal cortex, which is a specific area of the brain that is connected to the three networks involved with depression, which are the default mode network, the central executive network, and the salience network. And TMS is really, our best understanding is resetting those networks. TMS was FDA approved for depression in 2008 and has been used to treat and significantly improve the quality of life for many, many people since that time. Also, TMS has been FDA approved for smoking cessation as well as OCD, or obsessive compulsive disorder. I am very passionate about the effectiveness of TMS because of my experience, and it really changing the course of people's lives who have deeply suffered with depression. I'm actively involved in our International Clinical TMS Society. I've served as co-chair on our membership committee. I'm currently serving on the membership committee and our education committee, on the faculty of courses, which is our international teaching arm of our international society. Although TMS is only FDA approved for the conditions I mentioned, there's very exciting evidence and studies showing that TMS can be effective for a number of other general psychiatric conditions as well as neurological conditions. These include the treatment of pain, treatment of various addictions, treatment of cognition, and many, many other areas. This is such an exciting time to be alive, and I have such gratitude to be able to share this information. My only desire is to help decrease suffering. Thank you very much. for a number of other neurological and psychiatric conditions, including generalized anxiety, memory. But it helped my mother, and she's remembering better than I do.